Hello.
Hi. Okay, so I'm so excited about today. Let me introduce you to everyone before we get started. And I think people are just going to be blown away. The goodness of your heart to do all of this, it just is so humbling to me. But this is Julie Boit, and she is a bachelor's prepared nurse. She graduated from Azusa Pacific in 2001. She did go on to get her nurse practitioner license in family medicine, and then she went on abroad to get a higher diploma specializing in hospice. And then through her nursing journey, she started an organization called Living Room International that was established in 2009, and she's going to tell us all about it. And she's also a published author, and she has two books out. Is the second one out yet, Julie?
It comes out November 6th.
November 6th. Okay. She does have the first one. So she has three kiddos. Two of them had sickle cell. And that first book is called From Beyond the Skies. And it talks about their journey of getting bone marrow transplants. And then the second book picks up from when they went back to Kenya. And it's called Brave Love, a nurse's story of courage and compassion in a Kenyan hospice. So I'm so excited to have you on. Thank you for coming on. Thank you for making the time.
Yeah, thanks for having me.
Yes. So, as everyone knows who listens to this podcast, I start out by asking everyone, how did you even get interested in nursing?
When I was in high school, I was really looking at what I wanted to become, like high school students often
Right.
do. And so I knew I wanted to go into the healthcare industry, and nursing felt like the direction that I wanted to go. And so I applied to Azusa Pacific University as well as a few other schools, but was accepted there. And um, I really wanted to do patient care. And so that's what drove me there.
Yeah. Where are you from? Are you from California?
I grew up in Kansas City, and then I
Okay.
moved to Northern California when I was in high school, and then once I graduated from high school, I went to APU.
Okay. And then you graduated in 2001. What was your first nursing job?
I worked at Cedars Sinai in Los Angeles in
Okay.
their HIV infectious disease unit.
Okay. I mentioned this briefly when we were chatting before the show, but I used to work in DC, and it has a pretty high, I don't know if you call it prevalence or incidence rate of AIDS, HIV. And so there were clinics all over, and a lot of, well, I can't say a lot, but several people that I went to school with really had a passion, for that patient population and that community. And there was one friend of mine, his name's Andrew. He was on episode 8 or 9. He used to run a clinic in New York, and now he took a position working for Indian Health Service and helping them and the tribes, and he travels everywhere getting not only HIV services but STD and sexual health and that sort of thing. So I'm at least a little familiar with it. So you were on, and also I love Cedars. I'm a case manager now. If I ever have patients in the LA area, I try to get them in with doctors. I like UCLA too, but Cedars, it's just world renowned in their care. So you worked on, was it an HIV floor or in a clinic, or what did you do?
Yeah, I worked nights it was an infectious disease unit that
Okay.
was created for patients with HIV. And so 2001 was right after like the medications had become available, and now there was um, the cocktail of medications that was making it so that the patients were surviving, and they were beginning to think about like how long they would need to keep the unit. But that's I worked alongside incredible nurses who were so passionate about the population. And for me, the interest came. As a nursing student at APU, I went on a trip to Kenya, and
Okay.
I was working alongside of patients who they didn't have access to testing or treatment, and the population, at the time, the infectious rate was, like it was somewhere around a 6 to 10% of the population,
Wow.
young population who was infected. And so my interest really started from Kenya. But then
Mm.
when I graduated, I wanted to learn more and more about it. And I was really moved by the pandemic that was happening across sub-Saharan Africa. And so I worked in LA, but also had Kenya deep in my heart, and Africa, just what was going on with HIV and AIDS.
Absolutely. So when you started working on, the infectious disease unit, that was in the back of your head, like, this is my passion. This is somehow where I'm headed. Like, so how did you make the decision to start Living Room International? Well, actually, tell us what it is. What is Living Room International?
So before Living Room became a thing, I moved for what I thought was going to be a year to Western Kenya to work
Okay.
alongside of Kenyan leaders who I had met on short-term trips. And
Okay.
so I worked for a small nonprofit doing community-based mobilization around HIV, and I did it for 5 years, and it was an incredible experience of initially not having access to any testing or treatment, and then watching as those things became available, and um, how to really try to mobilize the community so that people could be tested, get access to treatment, the fear and stigma that was so prevalent could begin to reduce. Like, those were the things that our team, we were really passionate about, and watched as love replaced fear, like how
Mhm.
orphans, like kids who were going to become orphans, didn't have
Yeah.
to, mothers who were pregnant didn't have to transmit it to their babies. People who were 18 to 35 were the most likely to be infected, and so these young people didn't necessarily have to die from the disease. They could get on treatment. And so it was an incredible experience of watching things that felt so enormous and impossible,
Yeah.
piece by piece, like to see change.
Yeah.
Um, and then 5 years into my living in Kenya, is when I was really passionate about both the HIV population, but also people living with cancer who didn't have access to hospice
Mhm.
care. And so, thankfully, like when I first moved to Kenya, I also was really interested in hospice and palliative care, but treatable diseases should be treated.
Right.
And
Right.
so geography shouldn't determine whether you can survive a disease or not. If treatment is available somewhere, like, I just really believe and value that we need to work towards getting access to that treatment. But over time, as that happened, then also still seeing needless suffering and pain not well controlled, or psychosocial issues. There was a lot of needless suffering, and so really began to think alongside our team, like, how could we create both outpatient and inpatient service around hospice and palliative care. And so that's what Living Room, in 2009, when we started, we were small, paying attention to the suffering in our neighborhood, and it became over time a 24-bed inpatient hospice called Kimbilio that means refuge, serves adults and children, as well as we care for about 400 families in the community doing home-based care. And then over time, like, that grew further into doing funeral home services because there was great need around mortuary care and bereavement support. And then also started a second, what was going to be a hospice, but has turned into a community hospital, where really trying to get access and affordability of services for the people in our area. And so I mean, I feel grateful that when I moved in 2004, when we started Living Room in 2009, like, I didn't have any idea of the scope of what might grow into, or the team that would develop. Like, we have 150 Kenyan staff who show up every day and really love our patients with excellence and compassion. And then to see it grow to over 100,000 people we serve in a year, like, I
Wow.
didn't know we'd grow into that, but I feel
Yeah.
really grateful for the step-by-step journey that's led us to here, and still feel like there's a lot of important work ahead of us.
Sometimes you look back and, you think, you're like, well, I just had an idea. And I just thought, these people need some help. And then fast forward, that was 2004. Fast forward, we're almost 20 years, since you moved there. And this has exploded to help serving 100,000 people annually. And I'm sure it's going to grow. Oh my goodness. So you started nursing in 2001. You did a trip with school prior to that, and that's what sort of sparked your interest. And then and you did you permanently move there in 2004? That's when you moved there.
Yeah, I mean, I signed up to go for a year, and then after a year, I knew I wasn't done, and then after 2 years, it's like, I'm really starting to learn more about community. I loved the work that we were doing, and then it just kind of went from there, and then by 2009, I knew I was investing, into a longer term, time, and now it's almost 20 years.
Wow. So do you live there full time or do you come back? How often do you come back to the States? We'll say that.
So I'm married and we have our children, and we
Yeah.
are in Kenya about 10 months out of the year, and then
Okay.
here for usually two. I,
Okay.
I'm currently in Los Angeles, but
Okay.
most of the time we're based in Western Kenya.
I know this episode is going to air probably December. I'd like to do it right, before the holidays. And I'm hoping to make it, you're going to have, I forget what days it is. It'll already be past by the time this podcast airs, but I'm hoping to make it to one of your sessions, one of your interview sessions at Azusa Pacific. I think that's really great. So you get started. So you moved to Kenya in 2004 and you're working with local, is it a local hospital? Like, who are you working for?
In 2004, when I moved, I was
Uh-huh.
working for a small nonprofit called Empowering Lives International,
Okay.
and their focus was like partnering with Kenyans and looking at how to think about preventative health and community based health. And so much of the values that I have and the vision that I have, it comes from that time.
Hmm.
And then when I knew that I really wanted to step into hospice, they felt like that wasn't part of their vision. And so that's how Living Room started. So it wasn't in any way like a negative, it was just a growing and
Right.
a journey. Yeah.
Right. And so the people who work for Living Room International now, you said is it still 24 inpatient bed
So we
units,
have 2
correct?
campuses. So we
Okay.
have a rural campus where it's the 24-bed inpatient hospice called Kimbilio, means refuge, and then we have a second location that opened in 2019. Um, beautiful, beautiful campus that is at this point, it's a 60-bed hospital, and then we have operating rooms, we have ICU beds, we have maternity services, um, and we recently opened a 64-bed guest house on that same location for children and families who have cancer diagnoses, they've traveled from all over Kenya and are being treated at the nearby government hospital, but need a place to stay so that they can actually complete their treatment. And so we have an incredible team that is doing the work and serving the patients and families. And we really value holistic care. So, not just treating disease, but how do we care for people and looking at family units and how to make sure that, like for these kids specifically going through cancer treatment, how do we help them not feel alone? So, Living Room's vision is to be a community of compassion that honors life and offers hope. And so, we just feel like everything that we do, we want it to be through that lens of how do we think about um, honoring the people, valuing the people who come into our care. And hospitality is one of Kenya's incredible strengths. And how does that translate into healthcare? And so those are the conversations that our team have all the time. So even at our hospice, especially, we refer to our patients as guests. We want them to be welcomed
Mhm.
and honored. And in the way that we communicate to them that they know that they're valued, even if they don't have the ability to pay or, like any number of factors that have told them that, this can't be for me, this is too good for me, that we want to make sure that they understand that that it was built for them, and that we're so honored to be able to care for them.
Oh my goodness. How wonderful. Um, Gosh. So what do you see next for you all? You have two campuses now. You have the hospice services. You've expanded into caring for families and funeral services. Just more campuses, or what is your vision?
Well, it's a good question. I don't necessarily see building more campuses. I think that within the hospital that we've built, the model that we're trying to create is that it's reimbursable by the National Health Insurance Fund. So anybody who can afford to pay $5 a month for their family to have insurance, that they can come and receive care and not have to pay on top. So it's trying to get more affordable, accessible services to people who typically don't get to come to a hospital like what we've created. That feels so important. So how do we do it with excellence? How do we make
Right.
sure that the quality of our services, the core values of, like I said, hospitality and compassion and all of these things, how do we do that well? And then how do we think about impacting the larger healthcare system? So through education, through training, through research, how do we demonstrate through our care what's possible? Like that's what feels really important at this point. So thinking about expanding outpatient services, community-based services, like urgent care, emergency
Mm,
services, how do we do those things well? And
right.
then potentially have education center to be able to do training and education and simulation labs to be able to hopefully like improve the standards of care both within our center and then beyond.
Wow. So I guess that begs the question, how does healthcare in Kenya even work? I mean, how do you get plugged into their system?
So for many, I would say, like especially the rural poor, like accessing medical care, affording medical services is really challenging. And
Right.
there's changes that are happening right now about there's lots of conversations about universal health coverage, but practically for many, they're out in the villages. Cancer is not often not diagnosed over like almost all cancer diagnosis is received in stage 4. So the
Mm,
people who are actually surviving, it's not very many. So how do
right.
we think about preventative care like in the community? How do we think about like not just having large referral hospitals, but how could better services be closer to the people and affordable, and that the medication that they need is actually available? So I think that it's tricky, like
Right.
it's going to take a lot of time probably for it to really develop, but it also feels like things that once seemed impossible, it feels like little by little, how can we continue to like think about making sure that people in the community, they have like an accompaniment alongside of them, so it's not just barriers to care, but how do we think about like accompanying? And so that's a lot of what we're doing, working with community health workers, some working with social workers and nurses and doctors and the whole team, multidisciplinary team, to think about in our area what to do, and then potentially how that could affect a larger system.
Wow. I mean, this must have felt overwhelming when you started. Just how far you've come when you started Living Room International. You almost have to not have this. Well, I don't know that you wouldn't have a big, goals for yourself, but I would just get so overwhelmed. It would just seem like so much to navigate. But if you've been going over there and in the system for that long, maybe you felt a little more confident than I
No,
would.
I think it's overwhelming most days in certain
Yeah.
ways, but the Dr. Paul Farmer, who's global health leader, who passed away, when he was asked, "How do you not get burnt out?" He said, "Well, we do hard things with friends." And I feel like I've been
Mhm.
really, really honored to work alongside of Kenyan leaders who care deeply about the suffering of their people. And I think sometimes, yes, we make goals that can be for big things, but we also try to pay attention to what's right in front of us. And so, how do we look and listen to the person, in front of us? Like,
Yeah.
there was a patient that was at the hospice who was sitting on the veranda. We do a lot of our care outside, and I didn't know his name or his story, but when I went to greet him, he was speaking Swahili and he said, "Asante kwa kuniona." He said, "Thank you for seeing me." And I just think that there's this opportunity that we have as nurses to to pay attention. And I recently was reading about the word respect and how it actually means to look again. And
Mm.
I think about the word, often as like, how do we honor? But like to look again means like, how do I see beyond what may have been my first impression? How do I stay present enough that I can listen beyond what words might be being said at times, like to see a person, to see their value, and not only for the benefit of the patient, but also for me as the nurse. Like those meaningful exchanges, I feel like help me to stay engaged, help me to keep caring, and help me to want to like keep advocating. And then I would say, like, as a mother of children who have lived with chronic illness, like I've been on the patient side of things a lot in the last 7 years, and how that has also helped me to rethink many a thing.
I bet. Well, then that kind of segues us into your books. So you have two books. You wrote one. When was the first, From Beyond the Skies? What year was that published?
So, From Beyond the Skies was released in 2021.
2021. And then you have one coming November 6th of this year. Tell us about these books.
From Beyond the Skies is a memoir about our family's journey of through adoption. It's a lot about Kenya, and then it is our two little boys who experienced a bone marrow transplant. We were able to jump through many a hoop to be able to get them access to treatment, and that happened at UCLA. And so it's that book covers a 3-year journey of treatment to their cure, but also like with the trauma of treatment, just a process and reflection of the wonder of what happened, as well as the hard parts of it and the community that walked alongside of us. And then Brave Love starts actually when we returned back to Kenya. And
Yeah.
for me, as a leader within the healthcare system and opening a new hospital, but also just having experienced our kids' treatment, seen through a new lens of motherhood and all the things that have expanded my heart. And so, Brave Love is a collection of stories, really, of the last 20 years of living and working in Kenya. And it's held together through the themes of courage and compassion within community. And so, a lot of the things that we say are the vision of Living Room is actually what I needed to lean into to begin to heal from the traumas of watching our kids suffer so deeply. And so I wrote about it. And yeah, it's been, I think that writing for me is a way to really reflect. To, in some ways it's kind of like a form of prayer for me, but to just find words for the things that I feel so deeply, and then to be able to hopefully offer it as an invitation to others, into the wonders of love, and the wonders of what it can look like to walk alongside others too.
I think it's so amazing because, as you know, nurses struggle with burnout. They struggle with, we learned in nursing school, compassion fatigue,
Mm-hmm.
where you're just pushed to the max and you're just like, I'm out. There's no more compassion to give. But hearing these stories of triumph, and one, hearing that you're not alone, and two, I imagine for you as the author, it was kind of cathartic to get all of this that was in your head and in your heart out. And hopefully, hey, here's my offering. I hope that it can help you, and either help you if you're, going through it with kiddos that have had chronic illnesses, or if you're just a nurse and you need to find your compassion again and circle back to, why are we actually doing this? It's to help others. And yes, we need to earn money. Yes, we need to pay our bills. Yes, all of those things, but compassion. If you can remember compassion in those moments of difficulty, it can renew you. So thank you for sharing your story.
Yeah.
I know that it will help others.
And I would just add to that, like I feel like at times we talk about compassion as the offering, but what
Mhm.
I've really experienced is also for my experience has been as I've stayed engaged as I care, even when it's uncomfortable,
Mm.
those are actually the most meaningful. They can be the most meaningful moments also for me as the nurse. So it's like trying to figure out the vulnerability of how do I continue to care not only for the patient, but because it keeps me human and it keeps me engaged with my patients,
Yeah.
and in myself. So I recognize that nursing is it's filled with so many challenges, and after the
Mhm.
pandemic and the numbers of patients or the hours that are worked, like it's really hard. And I don't say any of this as like, let's be more resilient. Like I
Right.
feel more of this commitment though of what does it look like within our like to be committed even within ourselves to loving. So
Mm.
rather than allowing numbness or apathy to like get the space that I
Right.
think so often can happen, like how do I continue to care? Where do I need to take breaks so that I can continue to care?
Right.
Feels like has been a big part of the journey that I've walked, both I think as a mom of sick kids, but also a nurse. And then like how do I make leave room for my heart to stay engaged and to expand?
Right. Well, I think that message, like you said, is just so appropriate for nurses these days. How can I take care of myself? How can I take care of others? How can I show empathy, compassion, and show it to others, but also show it for myself and make room in my own heart in order to go through these hard things. So thank you for that. So where can people find Living Room International?
So you can find Living Room at livingroominternational.org
Okay.
or at julieboit.com. So both talk about Living Room's work and about the books, and I'd love to connect. I love I love connecting with nurses, and
Oh,
um,
good. Okay.
yes,
So they can find your email and contact you from your website at julieboit.com.
that's correct.
Okay. And I'll have livingroominternational.org in the show notes. I'll have julieboit.com in the show notes so people can get to you. And where can they find your books?
So at julieboit.com, it has links, but really anywhere that books are sold, you can find it. So
Well, I'm going to do a giveaway, Julie. I'm going to buy your books and I'm going to
mm,
do a giveaway.
thank you.
You're
Thank you.
very welcome. Gosh, it's humbling for me just to be talking to someone who has so much love and compassion in their heart and trying to share that with the world. So thank you for coming on. I really appreciate it. And we will be in touch.
Thank
You're stuck
you.
with me.
Thank you. There's one other thing that might be a good resource for nurses is there was a documentary that was made about Living Room's work that's available on
Oh,
Amazon also that's called The Space Between. And
oh,
it's was made years ago, but I think that it gives a really good overview of the work, and if someone's interested in learning more, that's also a good resource.
absolutely. I'm so glad that you said that. It's a documentary available on Amazon. Okay, I'm taking notes. I'm listening. I'm taking notes.
It's
I'm
great.
one of those nerds. I love to take notes. I have post-its,
Mhm.
I have notebooks, I have it all. Okay, Julie, thank you so much. I really appreciate it.
Thank you for having me.